Hello and welcome to the Imaging Wire Show. My name is Brian Casey. I'm managing editor of the Imaging Wire. We've got another great episode for you today. Our topic is an update on AI's evolution, and our guest is Dr. Rick Abramson. He is Chief Medical Officer from Annalise.ai. Rick, thanks for being with us today.
Brian, thanks so much for having me. It's great to be back on the show. I'm really looking forward to it.
It's good to have you. So can you tell us a little bit about yourself and about Annalise?
Yeah, sure. So it's been, I think, a year since we last did this, since I was last on the Imaging Wire. So
with Jake,
yeah, I gave a longer introduction last time, but just briefly. So Chief Medical Officer for Annalise.ai. I've been in that role for a little bit over a year now. I've had a long career going back and forth from the clinical to the business sides of imaging and back again. Diagnostic radiologist by training, academic background, as well as former recovering physician executive. I worked for HCA Healthcare here in the States for several years, leading their radiology service line, and then got so intrigued by the world of AI, I had to jump ship, and I landed in Annalise. And then so quick intro to Annalise for your viewers who may not be familiar. Leading developer of software as a medical device, diagnostic support AI solutions for imaging, based in Sydney, Australia. And the company has grown very, very quickly in concentric circles, expanding out from Sydney. The core product is diagnostic support, clinical diagnostic support for radiologists. We have a CXR or chest X-ray module. We also have a non-contrast head CT module, and we've been working very hard on broadening and deepening our product portfolio to expand the clinical value that we deliver to radiologists and to physicians in general. It's been a great ride, and looking forward to kind of catching up with you about everything that's been going on.
Very good. Well, it's been great to see Annalise grow. So as you mentioned, you were on the show a year ago. You talked to Jake Fishman then, and you talked then about 3 waves of AI. And so much has happened in the last year in AI that it's really been incredible, and it's a little tough to keep track of all that, but it keeps us all busy. Can you talk a little bit about what you've seen happen in AI for radiology over the last year, and maybe what's changed and what hasn't?
Yeah, sure. That's a great way to jump in. So rewinding the clock to last year, I did mention that I kind of see this industry as having evolved in these 3 big waves. The first wave 1, I kind of categorized as solutions in search of a problem, with elegant code, beautiful algorithms coming out of university settings, many kind of out via university tech transfer offices and whatnot, that were great for what they were, but didn't really seem to solve really compelling clinical problems. That wave kind of receded and was replaced by wave 2 that did solve pressing clinical problems and was really dominated by single point solutions, right? So algorithms for detecting pulmonary embolism, detecting intracranial hemorrhage, spotting lung nodules and whatnot. And that really kind of that was the first wave that kind of succeeded to get in actually establishing some market presence and some market traction. But my contention at the time a year ago was that second wave was also receding and about to be replaced by a third wave. Annalise being one of the companies at the vanguard of that third wave, characterized by multi-finding algorithms that extend over an entire modality. So instead of a solution for pneumothorax, you have a solution for chest X-ray. Instead of a solution for intracranial hemorrhage, you have a solution for head CT. And so, I've kind of been obviously pretty attuned to the market over the past 12 months to see if that prediction is becoming a reality. And from my vantage point, it does seem to be so. It does seem that we have these multi finding algorithms kind of becoming ascendant in the marketplace, just because it's delivering exponentially greater value to the clinical user. Now, what I did not expect a year ago, in which we've seen, and anyone who's kind of on the investment side of AI knows this. We've been faced with like tremendous increase in the cost of capital and just complete change in the macroeconomic environment. And so we've actually seen a lot of developers either cease operations or be become acquired. And what I think I'm perceiving is a real consolidation in the marketplace around a few kind of like really prominent high quality developers, the ones that have sufficient capital backing, and ones that have enough kind of penetration into the marketplace to kind of actually stake out a position and survive the downturn. And then from a capital funding standpoint, it's really a flight to quality. It's really the highest quality developers that are attracting the investment capital right now. And so that's been really interesting to watch play out. I think the other pretty interesting trend is the ascendancy of platforms, kind of platform offerings for AI. We've seen some developers actually pivot and become platforms, kind of just kind of change their strategy entirely and say, well, we're not going to develop software anymore. We're just going to be the market, or the middleman for other products. And then we've seen some pretty interesting developments on the government side as well. So the UK announced a £21 million funding initiative to promote AI adoption. We're seeing more regulatory activity across the board, globally, and the clinical evidence base is expanding as well. So all these developments, I think, are just kind of leading us to just a really, I think the term inflection point is probably overused, but I do think that we're actually at a point where the market is really going to declare itself, and we're going to really understand in the next 12 to 18 months where the entire industry is heading.
That's some fascinating thoughts. It seems like where we're going is we're trying to move into a place where AI is just easier for the clinician to use. And a lot of the points that you just mentioned, the move away from point solutions to multi-finding solutions, the move to platforms, is all related to how can we make AI easier for the clinician to use and not have to launch individual algorithms and hunt around for what they want to use. Is that kind of what you see happening?
Yeah, 100%. Ease of integration is primary. And gone are the days where the radiologist would be working over here and then swiveling the chair to work over here at a workstation. Fortunately, we've gotten past that point, but the integrations are still, for some solutions, fairly clunky. And everybody wants to get to the point where the AI software is seamless in the workflow, and there's no extra clicking, there's no extra boxes to open. And everybody's racing for that solution. So, the Annalise approach was to kind of design the user interface from the get-go, involving radiologists to kind of understand how radiologists think, how they operate, kind of how they live. There's other, the PACS vendors are trying to get into it. And so I think there's a lot of developers racing to integrate with the PACS. We're doing the same. We're working with PACS partners, trying to kind of, get that integration as seamless as possible, like I said. That plus the clinical evidence, I think, is really going to drive the adoption decisions, over the next couple of years.
Now, Annalise, let's talk a little bit about Annalise's solutions. Now, you mentioned multi-finding AI. That's kind of the road that Annalise is going down. Can you describe that approach a little bit?
Yeah, sure. So we really see this as the big differentiator, separating Annalise from the rest of the crop. From the get-go, from the inception of the company, the commitment was to producing robust, broad clinical support across entire modalities. The feeling was that you wouldn't buy a washing machine that only washes your socks. You want to do your entire load of clothing. So in the same way, why would you buy an AI support tool that only does one finding? So like I said, from the very get-go, there was involvement of expert radiologists, co-developers who helped in everything from designing the ontology trees to designing the user interface. We still involve these radiologist partners for everything from doing threshold adjustments and operating points and all that kind of really down in the weed stuff, to designing to thinking about our long-term strategic roadmap. But what we found is that this message of comprehensiveness really does resonate in the marketplace. That users really do want broad-based support, and we're starting now to see the evidence come in to show where this is adding value. So we know that we actually make radiologists faster. We actually enhance efficiency by having this cushion of diagnostic support underneath them. And we're actually going to be announcing some pretty impressive study evidence at RSNA, to kind of back up that claim and to kind of show prospective customers the kind of value we can deliver. But of course, it's not just efficiency, it's quality as well. And we have now ample examples of high priority, clinically important misses that were saved by having the Annalise tool on board. So there's efficiency, there's quality, there's the importance of delivering care faster to referring clinicians so that they can initiate treatment faster. And that's especially important in the US, which is kind of a market that's dominated by the triage use case. And we can talk about that a little bit as we go along. And then finally, it's really important, we're finding, to have broad-based AI support just to recruit and retain radiologists. And we're seeing, especially with the younger radiologists coming out of training, there's such a supply-demand mismatch that they can kind of, they can write their ticket kind of wherever they want. And one of the things they're insisting on is to go to a practice that has that AI support, because they know it's going to make their lives easier and also enable them to deliver better care.
Now, with respect to some of the clearances, now Annalise has been getting a lot of clearances lately. Have any of them been like more significant in your mind in terms of moving us toward this multi-finding kind of nirvana that we want?
Yeah, so it's interesting. So in the U.S., we have obviously this kind of different regulatory paradigm where findings are approved one by one as opposed to in large packages. We've had some separate conversations about the fact that this is actually probably is putting the U.S. at a disadvantage compared to the rest of the world in terms of the access to cutting edge AI support. And that innovation gap is actually it's now being exposed, and I think we're actually seeing some progress in kind of addressing that innovation gap and kind of moving the ball a little bit to modernizing the regulatory pathway. But as of now, yeah, the findings are approved one by one. What Annalise has done is basically set out on a mission to make ourselves the most comprehensive triage package in the US. And so if the message in the rest of the world is comprehensiveness in terms of the findings we cover, same message is true for the US. And we basically want to say to the market, hey, we've got the most comprehensive coverage available in terms of triage findings for chest X-ray and for non-contrast CT head. So that's what we've challenged ourselves to become. And so far, we're doing a pretty good job of it. As you know, we got we have 12 FDA 510 clearances now, and that was over the span of only 18 months. So it's a pretty remarkable accomplishment, and it's really testimony to our world-class regulatory and product and clinical research teams. They are just incredible, and I think it positions us well going forward because FDA regulatory is itself a skill. It's a core capacity, and we've spent some time really investing in kind of building up that internal knowledge of kind of what does it take to actually take a device through FDA. And I think we've hit on that formula, and so we're right now we've got those 12. We've got more in the hopper, and and we'll continue to broaden that broaden the package, but we'll deepen it as well, and we'll add functionality. So we don't plan to stop with triage, but it's a sensible way to kind of get started in the U.S. market, because that's kind of how the U.S. market is set up.
Makes sense.
Yeah. I was just going to say, probably makes sense to talk a little bit about this breakthrough designation.
Oh, yeah. I saw that. Yeah.
Yeah. So this is it's notable because it's, to our knowledge, this is the first time that the FDA has ever awarded breakthrough designation to a radiology triage product.
And which product was this for?
This was specifically for our obstructive hydrocephalus triage algorithm. And so, yeah, I mean, again, like, we have to approve our products finding by finding. So this was for obstructive hydrocephalus on non-contrast head CT, it's really, I think, testimony to the quality of the products and the depth of talent on the team. And also, quite honestly, Brian, I think it's testimony to the fact that Annalise is really kind of becoming a leader in technological innovation in this area. And the reason I call that out is kind of going back to the statement I made before about what's happening in the marketplace. So we've got a lot of other developers that are becoming a lot more conservative. They're kind of withdrawing into their shells. A lot of developers have kind of stopped taking risks on product development just because the market is kind of trying, and like I said, some have kind of pivoted their whole business model into becoming a platform for other developers' solutions. So yeah, we've really rejected that temptation, and instead we're saying, okay, here's a clinical challenge, we're going to meet it head on. I don't think anyone else would have dreamed to bring a obstructive hydrocephalus triage product to market, but we thought it was clinically important, and the FDA agreed, and they recognized the novelty of the contribution, and hence the breakthrough device award. So anyway, I thought it was worth mentioning. I think it's a real cap, and just again, it's testimony to the novelty and also to its expected impact on patient care.
Very good. Now you just mentioned clinical challenge, and that kind of brings to mind some studies that came out. I mean, it seems like over the last couple of months, there's been like this back and forth of a study will come out and it'll say you'll have a lot of positive findings about AI, and then that'll be counterbalanced by another study that says, well, hold on, it didn't do so well here. And you wrote a really insightful article on your LinkedIn page a few weeks ago. Could you kind of summarize real briefly for the audience, like some of those points? And is this kind of a normal process for any new technology that's proving itself?
Yeah, that was so interesting, that whole episode. And so, just for your viewers who may not be glued 24/7 to their seats watching the soap opera that is radiology social media. So there was an article published in Radiology, the great journal, the great radiology journal. The article was picked up by the media, and not just social media, but by the mainstream news media. The interpretation was that human radiologists outperformed AI solutions. And then I posted a response on LinkedIn and kind of pointing out that the study wasn't really fair comparison of humans versus machines, and it wasn't the all of it was kind of picked up by the media. From my perspective, it's all good. I mean, at the end of the day, we want people talking about AI. We want people engaged in the debate. We want people participating in the discussion, and that's what's going to advance the science, and that's going to accelerate the evolution towards useful real-world implementation. But to your point, to me, the most fascinating part of that whole discussion was just the very, very provocative conversation about how we should be evaluating AI. And so there was a lot of talk and a lot of back and forth, on LinkedIn and elsewhere about kind of different ways to do studies, different ways to build evidence about AI. So you start with, there's different ways of kind of studying AI and evaluating AI. The most basic is probably AI versus a reference standard. AI versus a gold standard. And so we would call that a standalone performance study. And there was a lot of talk about, that this is just a waste of time. It's not worthwhile because we're not really concerned about how the AI performs by itself. We're more concerned with how a radiologist performs with AI versus without AI. And I agree with that. However, from a developer's point of view, those standalone performance studies are still worthwhile because they're important in validating the technology, like for starters. They're often required by regulatory. And there's also a lot of good research showing that standalone performance is actually a pretty powerful surrogate for assistive performance measured other ways. So there's that, right? So that's standalone performance. Then there's AI versus other AI. Right. So that's an entirely different type of study that you could do. And again, in this debate, in this discussion, a lot of people said, well, that's not worthwhile either, because again, I'm concerned more with the radiologist and how the radiologist benefits, with AI, without. But from my perspective, I think AI versus AI is extremely important because without an AI versus AI, how's anyone going to make an informed decision about which solution to use, right? So, I mean, right now, I look at the marketplace, I think we are way, way too reliant on information coming from developers, right? I mean, it's developer produced evidence, and there's a huge range among developers in the quality of evidence being released and the claims being made on that evidence. So, at Annalise, we really try to hold ourselves to a very, very high standard of evidence, and we're pretty conservative with the claims we make. But having said that, I think that people shouldn't be relying exclusively on evidence from any developer, even from us. What we really need is independent comparative evaluation by unbiased third parties, if such a thing exists, right? And then we get into how are you going to fund it? Are there any kind of curated data sets that we can use for benchmark comparisons? It gets really complicated, but I think that kind of comparative evidence is really important.
Do you think there's a role for some of the societies in doing that?
Absolutely, 100%, 100%. I think the societies, I think there is a role for public-private partnership. That conversation is actually a lot more, I think, more advanced in Europe. In Europe, they talk about the importance for government entities and kind of public-private partnership entities to produce these giant curated third-party databases that you can use for benchmark comparison. The other discussion that you hear a lot in this context is about federated learning and about kind of linking together sites to kind of contribute into large multi-site evaluations, and kind of it's very technologically complex because you have to rig the ability to kind of go into different sites and pull out data that's somehow ground truth, and that gets hard. But those are exactly the kind of conversations that we need to advance. And what we really need to get to is like some kind of future state where there's a consumer reports for AI. I can open up an article and I can see this performs well, this performs not so well. I mean, that's what we need.
Yeah, like a clearinghouse or something like that.
Exactly.
That's a great idea.
Yeah, for sure.
We've got RSNA coming up in just a few weeks, and what are you looking forward to seeing there in Chicago on the AI front, and what can we look forward to seeing from Annalise?
Yeah. Okay. So there's two things I'm looking for going to RSNA. One is what we just talked about. It is those head-to-head, apples-to-apples objective comparisons. I'm hoping to see more of them because there's a real question in the marketplace right now about who's going to win? Who's going to win the race, basically? There's kind of like a tortoise and the hare race going on right now. There was a lot of developers that were very quick to market, came out with products that were, maybe not so great in terms of accuracy and user interface and customer support, but they're out there, and they've kind of gotten integrated into different sites. And if we produce now evidence, showing one solution is better than the other, the question that I think everyone is asking is, will you see switching? Will you see people switching from one solution to the next? And I don't know the answer to that question, because there's costs to switching, right? That's why economists call it switching costs. And so these tools are going to be so integrated, and there's going to be so much inertia that people will just say, well, there's a better solution out there, but what I have is good enough. Yeah. Or will you see that switch? I don't know.
Well, do you think if we do adopt a platform approach on a wide basis, and you have multiple different applications available for the same clinical use, I mean, couldn't it be simple to switch or even apply, multiple different algorithms from different vendors, and then just use the one that you like the most?
Yeah. And some platforms have positioned themselves for exactly that, right? So they would say we've got multiple vendor solutions. You can compare them using our platform. You can kind of go in and out, and that may be that model may end up being very, very viable. Of course, you have got also all the downsides of platforms in that situation. You're kind of one step removed from the developer. You may not have the kind of the direct developer support that you would get with a direct integration. The user interface might be degraded because the vendor has to kind of tailor their solution to fit into the requirements of the platform. But it's not a bad setup for comparative benchmarking, to your point. And I would love to see that use, kind of propagated. So anyway, that's one thing I'm going to be looking for at RSNA. The other big thing that I think is going to get a lot of talking is report generation. I think there's going to be a lot of evidence, a lot of talk about report generation. And, without, spoiling the announcement too much, we are going to be making some announcements at RSNA, and we do aim to have a draft reporting solution available for clinical use, by the time RSNA rolls around.
And if people want to see that, they'll be able to come by your booth. It looks like you are in the South Building, 4718.
That's what I'm told. I haven't seen the floor plan myself, but yeah, 4718 is in the South Building. Is where I'll be heading.
Very good. Well, Rick, thanks so much for talking to us today. It's always fascinating to have you on the show, and thanks again.
Oh, I appreciate it. Thanks so much, Brian. Have a good one.
All right. Signing off for the Imaging Wire, I'd like to thank Dr. Rick Abramson from Annalise.ai for being with us. My name is Brian Casey from the Imaging Wire.